Month. It's designated to raise awareness for common ear, nose, and throat problems suffered by kids.
And children with Down syndrome, for a variety of reasons, have a much higher need to visit an ENT doctor. Derek Francis explains in tonight's Medical Moment.
Down syndrome is one of the most common birth defects, affecting approximately 1 in 800 babies.
Down syndrome is a congenital genetic disorder. Technically, it's described as trisomy 21, which is an extra chromosome 21 that is found in all children with Down syndrome.
About half of all babies with Down syndrome are born with heart defects. Some defects can be treated with medication, while others require surgery. Dr. Chad Afman is an otolaryngologist with Spectrum Health. His Down syndrome patients often deal with other prevalent problems.
In regards to otolaryngology care, typically there are 3 areas that we address, both ear concerns, breathing concerns, and recurrent infections.
Children with Down syndrome are highly prone to acute otitis and middle ear fluid.
That has to do with their anatomy. They typically have smaller ear canals, which make earwax buildup and strumen impaction more common, making the exam harder, but also can lead to some conductive hearing loss.
However, Dr. Afman says recent findings prove permanent hearing loss is no longer considered more prevalent.
The majority of hearing loss in children with Down syndrome is due to chronic middle ear fluid. That being said, about 80% of children with Down syndrome do require ear tubes to take care of that chronic middle ear fluid, but with that being done, 90% of children with Down syndrome will have normal hearing.
Breathing problems are also a common concern for patients.
Due to the small nasal passages and sinuses in children with Down syndrome, they're very susceptible to recurrent sinus infections and recurrent nasal drainage, particularly during the winter months.
Like in winter months for the rest of us, Down syndrome patients are susceptible to catching something year-round.
Children with Down syndrome also have a relatively immature immune system, making them more prone to the common upper respiratory tract infections that all kids have when they're younger. That does tend to get better with time.
For parents of a baby with Down syndrome, seeing an otolaryngologist early can go a long way in easing concerns.
A lot of children with Down syndrome have a need for an otolaryngologist, and we feel like we can definitely improve their health and help out families with their care.
Derek Francis, Fox 17 News.
All right, so Joe's back with the final look at the forecast. Bundle up for tomorrow, right?
Oh, later tonight.